Joining me live over the phone, U.S. Congresswoman Harriet Hageman of Wyoming today. Congresswoman, good morning. How are you today?
Good morning. I'm absolutely wonderful. How are you?
Hey, doing fantastic. Really do appreciate the time. One thing we haven't had a chance to ask you yet, Congresswoman, is in the busyness of being a United States representative, what is a normal, quote, normal day like for someone who's in Congress? I'm sure it's all over the place, but maybe give us a little behind the curtain scenes of what it's like to be in Congress.
You know, every day is a little bit different, but very exciting and quite interesting. Yesterday, I had, maybe 8 or 9 meetings, half an hour, 45 minutes at a time, meeting everybody from county commissioners to oil energy companies and just all different kinds of constituents addressing the issues that are important to them. We go to the floor and we vote. I've had the opportunity this week to debate several very, very important pieces of legislation, including the Resolution 130, House Resolution 130, which nullified the Biden administration's moratorium on coal production in the Powder River Basin. So that is a huge bill that we got through this week on the House. I debated that earlier. It immediately went over to the Senate. They expedited it over there with Cynthia and John taking a lead role in that regard. We're hopefully going to get it passed on the Senate side today and get it to the president's desk for signature, which is just such a huge, huge, huge development for the state of Wyoming and actually for energy production and energy independence for the entire nation as a whole. So I spend a lot of time visiting with constituents who come back here to visit. We have a lot of correspondence that comes out of this office. When people write us a letter, we respond, whether it's about the Epstein files or it's about a bill that I'm doing or a particular hearing. I also am doing committee work. In fact, I just came downstairs from the Natural Resources Committee room. We are debating the SPEED Act right now, and the SPEED Act is the modernization of NEPA. This is the first time that NEPA has actually had an overhaul in over 50 years. What this is to do is this is part of our bigger agenda for permitting reform. Again, extremely important for a state like Wyoming. I was just debating that bill, and I'm going to go right back up as soon as I'm finished with you. It varies, but it has a lot to do with constituent services, engaging with the committees on issues that are important, such as yesterday, addressing the problems associated with the 2020 census and how those problems actually resulted in about 6 additional Democrat representatives in Congress because they overcounted blue states and undercounted red states. So we're doing an investigation into that. And then, again, voting and being on the floor.
Well, I'm glad you brought up Resolution 130, which passed out of the House. Let's go back to that and spend some more time on it because it is a big deal for Wyoming. Give us some more background on what the Biden-era Buffalo Field Office Resource Management Plan did and why you wanted to get this amendment through, or this resolution through, I should say.
So FLTMA, the Federal Land Policy Management Act, was adopted in 1976, and it essentially governs how we manage our federal lands, primarily the BLM lands. And when you go back and you look at FLTMA, it's very clear that Congress intended that we would be using these resources for energy production, grazing, recreation, access, all of those different kinds of things. So it was just very, very important that we be able to use these resources because the federal government owns about a third of all the surface estate in the United States, about 615 million acres. Well, over time, various environmental groups and things have been pushing to constrain our ability to use and access and develop our resources from these lands. And it actually culminated a couple of years ago in the Biden administration issuing what's called an RMP, a resource management plan, that would have cut off all leasing of coal within the Powder River Basin, all federal coal. Well, for goodness sakes, 40% of the coal in the United States comes from the state of Wyoming, and the vast majority of that comes from the Powder River Basin. 25% of our electricity is generated by coal. We send coal, Wyoming sends coal to 26 different states for purposes of generating electricity. So the idea that we would forego the use of this resource and not even being able to access it was absolutely crazy. So what we did is we introduced what's called a Congressional Review Act resolution. And what the CRA process allows Congress to do is that for any regulation, any agency action that we disagree with, we can bring a resolution and we can nullify that resolution if we get sufficient votes in the House and the Senate. So John and Cynthia and I used that process. We first used it working with the Montana folks. We used it on the Miles City RMP, which was the Montana side of the Powder River Basin, and we received the approval of the GAO to use this mechanism to nullify the Miles City RMP, and now we've done it with the Buffalo RMP, thereby making it so that the BLM in the future cannot impose a moratorium on coal production in the Powder River Basin.
Congresswoman Harriet Hageman on the weekday wake-up this morning with SVI Radio. Congresswoman, last we talked, the government shutdown was still going. That, of course, has ended. What happens now moving forward, especially when we start talking health care and the subsidies, and what kind of conversations are taking place right now?
Well, they are taking place right now because we recognize that with Obamacare, it basically broke the system. And the reason that these subsidies have become an issue at all is because Obamacare, the so-called Affordable Care Act, is not affordable at all. And it has created a terrible crisis. So 3 years ago, when the Democrats controlled the White House, the House, and the Senate through reconciliation, they passed a bill that basically said you could make an unlimited amount of money. You can make $1 million a year, and we, the federal government, will subsidize your health insurance. And what they were doing is sending money directly to the insurance companies, not to the individuals, but it resulted in insurance companies making a substantial amount of money during this process. Well, because that has a 10-year price tag of almost $500 billion, they had to cut it off at the end of December 2025 because the price tag was just simply it's so astronomical they couldn't even justify it. So that's where we are. What you're seeing with the insurance companies is their rates are increasing. That is not necessarily tied to these subsidies. If you make 4 times the poverty level or less, your subsidies will continue. So, for example, a family of 4 can make $120,000 a year, and you will continue to receive the subsidies. But we recognize we have got to figure out a way to actually address the skyrocketing costs associated with health care. I have had constituents write to me that they are going to spend as much as $5,000 a month on health insurance. Well, nobody could afford that. I couldn't afford that. We can't afford to spend that kind of money. That's $60,000 a year on health insurance, and you would most likely have a deductible as well. I've been visiting with some of the doctors in the Doctors Caucus as to ways in which they see that we could potentially fix some of these issues to try to address these increasing costs. I know that there are several ideas that are being considered and discussed out there. I am hoping we can move quickly, but this shutdown didn't help. This shutdown really delayed our ability to move forward. That's why we're having, votes at 8, 9, 10 o'clock at night, because we're trying to catch up after not being in office. We're adding days to the calendar of not being back here voting. So the shutdown hurt us, and one of the areas where it hurt us is affecting our ability to try to find some relief for the American people.
You mentioned speaking with quite a few people in the medical industry about maybe some potential solutions. What do you see as a potential solution to the cost of health care right now in the United States?
One of the problems that we have is that with Obamacare, in Wyoming, we don't have competition. All of our insurance companies left, other than Blue Cross Blue Shield. Another issue is whether we ought to be should we be able to buy health insurance across state lines? That's something that has been discussed for years. And I think that, especially in a state like Wyoming, could potentially provide some relief. There are several others. I don't necessarily want to go into the great amount of detail simply because I don't know if any one of these are going to end up being what we do, what is decided to do. But I know that the president is talking about sending money directly to the individuals to buy health insurance. And in reality, Obamacare was adopted in 2010 ostensibly with the idea that there were 20 million people that did not have health insurance. That was the excuse for it. And essentially, they ruined the health insurance system for 330 million people trying to address those 20 million. Had they simply subsidized those 20 million, they wouldn't have had to wreck the system. But that really was not the intent. The intent was to force us into a single-payer system like what you see in Canada and Europe, and we don't want that. And the subsidies, that again, trying to get everybody onto the single-payer system is what they were trying to do a couple of years ago with the subsidies, and it hasn't worked because financially we can't afford to do it. So one of those things that has got to be addressed is stopping states from California giving health care to illegal aliens. That's one of the big costs that we have that we've got to be addressing. And those are just some of the ideas, but I know we've got to try to find a way to be able to provide health insurance without it breaking the bank.
Well, Congresswoman, I did want to ask real quick about the Epstein file vote. After years of nothing happening there, all of a sudden it's a nearly unanimous vote for those files to be released. What changed and why the vote?
Well, we need to put it behind us, and not because it isn't important and these files shouldn't be out there. They should. The point of it was I didn't like the procedure that was used doing a discharge petition. The fact is that the Oversight Committee has released almost 70,000 pages already. And those, they are the ones that have the subpoena power. It's the Oversight Committee that actually was able to subpoena Epstein's emails, and we are finding all of this information out about his contact with Democrats. People were not opposed to releasing the files. We believe that they were doing that pursuant to the orderly process that you find with the Oversight Committee, which is exactly what was happening. So voting for it or against it didn't necessarily matter. All of the files are getting out there right now. I voted in favor of it because we all want to have the files out there. So if this helps to get some additional files out there, so be it. That's great. At the same time, there are a lot of issues like what we were just talking about that I think are so incredibly important. I think what the Epstein files are going to show are exactly what I predicted a long time ago, which is he was a Democrat. His contact is going to be with Democrats. He donated money to Democrats. That's what you're going to find in these files. Whether there are names, whether they're going to identify other men who may have engaged in this horrific contact, I don't know the answer to that. I do know that there's almost 70,000 pages that have been released just in the last 6 weeks or so.
Congresswoman Harriet Hageman on the Weekday Wake Up. Always appreciate your time. Anything we missed you'd like to touch on today?
No, I think that this was great. It's always so wonderful to be with you, Duke, and have the opportunity to give an update on what's going on back here. And it was kind of fun to talk about, what a day in the life of being a congressman is in Washington, D.C. There's aspects of it that, were surprising to me when I came back here, but I guess I feel incredibly blessed. I'm so honored to represent Wyoming. I am so honored and I am so blessed with the staff that I have. They love Wyoming, and they're very dedicated to helping people. I think we're over $11 million in terms of bringing money back to Wyoming that various federal agencies have been improperly withholding from individual Wyomingites. And so I'm very proud of the work that my staff does in that regard. And we'll just keep working for the state, for the citizens of my great state. And I hope everybody has a wonderful Thanksgiving. Absolutely.
Thank you so much. That's Congresswoman Harriet Hageman this morning. It's the SVI Radio Network on Swift 98 and The Spur.